Hello everyone and welcome to this webinar on clinical practice guidelines. Today we're going to explain how to do the data extraction using our data forms. So the key issues we are going to address today is easy. We are going to talk about the data extraction form. Depending on the type of the outcome, we will see that the data will be different. Also, we are going to talk about the new timelines because we are quite delayed in the full text screening. And finally, just to show you where you can find all tutorials about these phases we have done before. This is the outcome list. So in order to be a standard, we would like you to use these names of the outcomes, trying to avoid another similar names. So in the data extraction form, you have the list of the outcome, so you can choose or you can pick the name of the outcome before filling the table. So the data extraction form has several sections. The first one is the general information. You have to extract data about the author and the year, so reference, the study author contacts, if it's available and easy to find in the text. Could be nice to have this information here, because in order to have data when they are not available, it's easy to go to the data extraction form and find the email address. Then the publication type. So is it a full report, an abstract, or is another type of paper? Usually we are going to find abstracts and full reports or papers. In case you want to do some notes, you can write down here in this section. So the next one is the methods. So we start with the characteristic of the included studies, and here we need to give some information about the methods used in the paper we are extracting data from. So the first one is the aim of the study. Usually this aim of the study is at the end of the introduction, so it's easy to find something like the aim of the study is, or the objective of the study is. And then you can copy and paste. If you want to copy and paste, we suggest you to just to write down the information exactly as it is in the report, and then on the last column on your right, just put down the number of the page. Then the second field is the design. So trying to give some information about the design. If it's a randomized control trial, no randomized, parallel crossover, or even if you have no idea about the design, just state something about this is a prospective cohort of patients or a registry or something like that. Then the unit of allocation. I think all the studies we are including, the unit of allocation is by individuals. So that means we are comparing individuals or using data from individuals. In case we have some type of cluster or groups, I encourage you to describe here. But as I mentioned before, I think 100% of them are individuals. Then the start date and end date. Some papers, they have a starting date and ending date of the recruitment or the registry or something like that. So if you have, usually you have the month and the year, so it is enough with that. If it's a randomized control trial, perhaps you have a day of starting recruiting and the end of the recruiting. Okay, so keep in mind here we are talking about the recruiting time or the length of the study, right? We have another field where you can put something about the follow-up. Then the duration of the participation, you have a tip here. So from recruitment to last follow-up. So here is the full duration of the participation, right? And the last field is if you need some ethical approval and you have obtained it or not. Then we have the big part of participants. So here are things that obviously we can find easily in the paper. So description of the population, children between this age and this age with some special characteristics like a second transplant or something like that. Okay, the setting. So if you can say it's a hospital, big one or small one, or it's a net of hospitals or something like that. The inclusion criteria and exclusion criteria briefly, so we don't have to go further on this, but we need the main inclusion criteria and exclusion criteria of the paper. Then how they have done the recruitment. Um, well, here you can say just consecutive patients or recruit by consultation or something like that. If there is something really different, like a phone mailing or something like this, you can write down. If they have obtained informed consent, sometimes it's not present in the paper. So if it's not present in the paper, just say unclear. Okay. Don't assume that if they don't say anything, is they have used the informed consent. Then the total number of patients randomized or not randomized. I mean, here we have written total number of randomized, but if it's not a randomized control trial, if it's a cohort of patients, just say the total number of patients. Clusters, if there are clusters, if not, keep this empty. If there is any baseline imbalances, which is not very usual in this type of studies, we are in this type of population. Withdrawals and exclusions, if apply. Mean age, if possible, stay always mean age, standard deviation, and the range. Okay, we need at least mean age and standard deviation, but it's very useful if you can write down the range of the age. Sex, just say a percentage of females or males, is up to you. Race or ethnicity is not something important for us, so it's no. If you want to write down and it's easy to find in the paper, fine. If not, it's not a big deal. Severity of the illness. Okay, that's something that we would like to keep in mind in terms of doing some kind of subgrouping or sensitivity analysis. So I mean, if our patients are children receiving an organ, and we want to say like something like is the second organ or is after failure or something like that, we can put here. And also about comorbidities. But again, comorbidities if it's something common to all the group. I mean, obviously there are some patients with comorbidities and some others without, but only here if they state in the inclusion criteria or exclusion criteria some kind of morbidities, then could be nice to write down here. But again, I think we are not going to face anything about that. Then once we have filled the population data, we go to the intervention. And here keep in mind that I wrote down intervention group 1. I don't know, depends on the studies. Probably we could have one, two, or even three groups. So just copy and paste this table and fill with the name of the group. I mean, instead of saying intervention group one, say intervention group one columns and say the name. I don't know, cyclosporine or tacrolimus or whatever. Then the group name used by the author in the paper, number of people randomized, the theoretical basis of doing this grouping. This is something we are not going to face here probably, but in case you find and want to fill it. The description, just say how the intervention is decided. If we can include here dosages and information about how many drugs they are receiving and if there is change or tapering in doses along the post-transplant, post-surgical time, it should be nice to write here. Okay, duration of the treatment. So probably if we are talking about big registries with a long follow-up, probably we can state the duration of the treatment. If we are talking about small studies with short following periods, probably we don't have enough information. But anyway, just report whichever you find, right? Uh, Timing, delivery, how is delivered, providers, if there is need to do that. We are not dealing with anything about who is providing the medication. Uh, Only if we are talking about young children where the parents are responsible of the medication and we want to state that, we can do it, but only if the author is mentioning in the paper. Okay, and about compliance, could be nice to have data about compliance, but I'm afraid that we are not going to find anything, right? And something about co-interventions. So here we have the outcomes. Remember, you have the list of the outcomes in the extraction form. So just go to the extraction form and choose one of the names and copy paste here in outcome name. Please don't use your own words or the words of the author. If you don't have a clear idea about the author outcome match some of our outcomes, just put the outcome name state by the author in brackets, and beside that choose one of the outcome names from the list, right? So the second field is the time point measures. Remember, we need to say they are measuring 6 months, 3 months, 1 month, 40 weeks, something like that. So just state all the time points they have measured. Then the outcome definition. I mean, we can choose that, or we can fill that in case of some outcomes that can be diagnosed or identified clinically and, for example, histologically. And then we need to state that. So this outcome is a clinical identified outcome, or is an histological one. So have a look to the outcome definitions we have done in the previous weeks or the previous months, and match that, right? So person measuring or reporting, again, if it's stated in the paper, is fine. If not, well, it's not a big issue for us because we are not expecting to have any blinded studies. Unit of measurement, so that this could be nice in case we can have some different type of measures. Scales, so if they are using a scale like health-related quality of life scales, just say which one is the minimum and which one is the upper limit, right? So if the outcome is validated, the technique or the scale or the questionnaire is validated or not. The imputation of missing data, in case the author is using some kind of imputation method like last observation carried forward or something like that, you can state. Um, Assume risk estimate. Well, I mean, usually this is in the background in the introduction, so I I couldn't insist much more on that, right? And the power and sample size calculation, this could be nice, okay? So if they have used an 80% of power or something like that. For the outcomes, just copy and paste the table, the number you need it, all right? Okay, so this is for the data and analysis. So you will have in the data form different tables for different type of outcomes. This one is for dichotomous outcomes, just outcomes like event yes or no. You have another one for continuous measurements or continuous outcomes, as can be some blood concentration of something, or growth, height, weight, and you have a similar table. It's not exactly the same, obviously, but something similar. And also we have included another one, which is for other type of outcomes, right? So if you don't have clear that the outcome is dichotomous or continuous, it's like a rate or something like that, you can use the third table. So here, the first one, yes, the comparison, they are doing the name of the outcome, if there is subgroups, which subgroup, and then the time point and the results. That means we have to put if the event is present in the intervention group, we need to fill the box saying number with event, and then total in group. Okay, so in case we don't have this information because they give like a ratio or risk ratio or hazard ratio, then please write down in the first column below results. So you can fill this saying, okay, we don't have the raw numbers, but we have this odd ratio or this risk ratio. Okay, and then number of missing participants, reason of missings, as we mentioned before, number of participants move from one group to another group, the reasons, the unit of analysis, again, if it's individuals, cluster groups, or something like that. If they have done some statistical methods, it could be nice if you can report here. Okay, and then the last two rows, reanalysis requires and reanalysis possible, forget about that, okay, because only the people who is going to work in the analysis can fill that. And for the continuous outcome, you can see something similar. Instead of having number of events, we have mean, standard deviations, and number of participants. The rest is exactly the same. And in other outcomes, we have said just, okay, give me something about how they are measuring the intervention. So intervention result, control result, and the standard errors or other type of variance. Okay. So this is for the data analysis. So the extraction, the data extraction, we probably facilitate you the data extraction of each study. That means if we have included like 200 studies, we will share this information and we will give you each of you 3 or 4 studies with the data extraction forms pre-filled. That means we can put the name of the author, the year, and so on, right? So in terms of milestones, we have to move the full text screening 1 month. So instead of being ready yesterday, we will have probably by October if we work together. Then everything is moved 1 month. That abstraction will be done by the end of November. Risk of bias assessment by December. The data synthesis and quality assessment by the end of January, and the first draft by the end of February. So these are the new milestones. Okay, and I think that's all. Just remember that you have all tutorials about all the guideline development and some information extra about how to work with Covidence or with data extraction here in our website. So actions, just work on full text screening to avoid more delays. The next webinar will be on risk of bias. The date is not just established because we have moved dates, so you will be informed. Okay, so thank you very much and hope to see you working on that. Bye.